You may or may not be a smoker, but you probably know someone who is. This video is all about the benefits of quitting, and we're hoping it motivates people out there to quit. So check it out, and if you agree, please share it with someone you know who smokes. I always tell my patients it's never too late to quit smoking. And the reason I say that is that many smokers assume that once they've smoked for a period of time, there's no point in quitting because the damage has already been done. But the reality is that no matter how long you've smoked for, whether it's been decades or just a few years, and whether you're a heavy smoker or just a casual smoker, the minute you quit smoking, you will start accumulating gains. So what actually happens to your body when you quit smoking? Let's get into it. To understand the benefits of quitting, we've got to talk about the damage caused by the actual smoking. There are over 600 different ingredients within that tobacco leaf, but when you burn it, you get over 7,000 different chemicals in the smoke. And it's those chemicals that you breathe in that do the damage. Many of them are toxic in different ways, and about 70 of them are known to cause cancer. And not only does that smoke contain all of those toxins, but it also contains nicotine, which is the main chemical that makes smoking so addictive. And many of those substances have both short-term effects and long-term effects on the body, which means that some of the benefits of quitting will come quickly, but others will take more time. So what happens quickly? Within about 12 hours, the carbon monoxide level in your blood drops to about normal. By 24 hours, the nicotine level in your blood drops to 0, and that's why those first few days after quitting are the toughest, because your body is in that nicotine withdrawal. But the good news is that as these substances start to go down, even 20 minutes after your last cigarette, your heart rate and blood pressure start to drop. And in fact, your heart and blood vessels have a lot to gain from you quitting. The chemicals in that smoke damage your blood vessels and increase your blood pressure while also reducing your good cholesterol. That exposure then increases your risk of coronary heart disease and heart attacks and the risk of having a stroke. But quitting makes all of that better. Within just 2 to 3 weeks, we start seeing improvements in your circulation, and your chances of having a heart attack will start to come down. Within a year of quitting, your risk of coronary heart disease will be about half of what it was when you were smoking and will continue to drop after that. And as early as 5 years out, your risk of having a stroke will also come down to the risk of a non-smoker. But there are some long-term effects that take longer to undo. The big one is the risk of cancer. Most people recognize that breathing those toxins into your lungs can cause lung cancer, but remember that on its way into your lungs, that smoke can also cause mouth cancer, throat cancer, and cancer of the larynx or the voice box. What people also don't realize is that those chemicals are absorbed from the lungs into the bloodstream, which means they basically make their way all over the body. So in fact, there are many different cancers that are caused by smoking, and that includes cancer of the esophagus or the swallowing tube, the kidney, liver, bladder, pancreas, stomach, colon, the cervix, and some blood cancers. Overall, smoking still accounts for about 30% of cancer deaths each year. But quitting will reduce your risk of having all 13 of these types of cancer. Within 5 to 10 years of quitting, your risk of mouth, throat, and larynx cancer will be about half, and by the time you're 10 years out from quitting, your risk of lung cancer is less than half of that of a chronic smoker. But let's not forget the direct damage that smoking causes in the lungs. Smoking can destroy those tiny air sacs in the lungs called alveoli, and that leads to a disease called chronic obstructive pulmonary disease, or COPD. It's also known as chronic bronchitis or emphysema, where you basically develop these holes in your lungs and gradually become more and more short of breath. And quitting will reduce your chances of getting COPD, and even if you have COPD, although some of that damage is permanent, once you quit, your lungs will start to repair themselves, which means that the rate at which you lose lung function will slow down to a normal rate. Quitting will also improve COPD symptoms like cough, phlegm, and wheeze. In fact, the reason people have a smoker's cough is that tobacco smoke damages these tiny hair-like structures called cilia that line the airways in our lungs. And these cilia are designed to basically sweep harmful material out of our lungs by trapping it in mucus and gradually moving that mucus up. But when they're damaged by smoke, those cilia don't work, and some of that mucus and those particles then get stuck in the lungs. Then while the person is sleeping and not smoking, the cilia have a chance to start working again, so by morning, the person will wake up with a smoker's cough, and that's basically your lungs trying to clear up a whole day's worth of mucus and particles. This is also why for the first few weeks after quitting smoking, As those cilia fully recover, some people will paradoxically feel like their cough actually gets worse. But that's actually a good sign. It's your lungs finally working how they're supposed to work and basically cleaning themselves out after years of smoking. And ultimately, this will subside and the cough and phlegm will go away for most people. But COPD and cough aren't the only risk to the lungs. Smoking can also act as a trigger for other conditions like asthma. It also increases your susceptibility to lung infections like pneumonia and tuberculosis, and not only through direct damage, but also by weakening your immune system. Not surprisingly, people who quit smoking tend to have less illnesses like colds and lower rates of bronchitis and pneumonia, and they generally have more energy and can do more exercise than people who still smoke. Now, it is true that a lot of people use cigarettes to help with their anxiety and depression, but studies now show that mental health actually improves after quitting. Measures of anxiety, depression, and stress all come down after quitting, and this is associated with a more positive mood and a better quality of life. And these effects were seen both in the general population and in people with mental health disorders. And don't forget the side benefits. As many people will tell you, it's not just the lungs that recover, but also the tongue, the mouth, and the throat. Your sense of smell will return to normal, your food will taste better, and you won't have that smell of smoke on your breath and in your hair and on your clothes. Whether you're a man or a woman, quitting will also improve your fertility, and if you've had erectile dysfunction due to smoking, quitting will make that better too. Finally, that yellowing of your teeth and your fingernails will stop, and best of all, you'll save all that money that was going towards cigarettes. And for all of these things, the sooner you quit, the better. If you're under 40 and you quit, your chances of dying from a smoking-related disease go down by 90%. Quitting will also add anywhere from 2 to 10 years to your life, depending on how long you've smoked for and how old you are when you quit. And those years you gain will be better years because they'll be healthier years. If you're thinking about quitting but you're worried that the damage is permanent, much of it isn't. The harms and risks of smoking are with you for as long as you're still doing it, but they will gradually diminish after you quit. In fact, by about 15 years out, the average smoker's overall health risk is similar to that of a non-smoker. So if you are thinking about quitting and starting that recovery process, it's a great time to speak to your doctor or to call the Lung Health Line and get some help. Which reminds me, shout out to the Lung Health Foundation for supporting this video. For more health and science info, subscribe to the feed.